They just took Biden-era rules that were designed mostly to simplify the system, and they just obliterated them. And so there is an increase in bureaucracy. It just adds red tape to the system.
Are you on? Which side are you on?
We've got David Dayen, executive editor at the American Prospect, on the line with us. David, welcome back to the program. Appreciate your time.
Thanks for having me on.
So you've been doing a lot of reporting on this one big, beautiful bill, and you're really knowledgeable about everything that's been going on. And there is just it's amazing how fast that I think that this has been able to pass, and how little most people know about it. So I want to go through a few of the kind of big topics within the bill with you to try to, let people know what's going to happen. And I think the first thing that I want to start with is actually the timeline of how this is going to be executed, because they have been able to basically make the good things kind of happen first, or the things that are not going to hurt, the tax cuts and things like that. And the bad stuff, the Medicaid and the SNAP cuts, my understanding is that it's not going to take place until after the midterms in 2026. Can you break down the timeline of how this bill is going to be rolling out?
Yeah, I mean, that's generally right. But when you talk about the good things, you're talking mostly about the extension of the Trump tax cuts. And those are the current tax policy that we have in place right now. So it's really going to be more of an extension of current law. And for a lot of people who don't get overtime, or people who don't, are not tipped workers, they're not going to really see any difference from this bill in terms of their tax liability. There are these temporary tax cuts that I just mentioned: no tax on tips, no tax on overtime, no tax on interest on car loans, certain car loans, and no tax or a boosted standard deduction for seniors. Those things are all time limited, and they're actually going to be done by 2028. But there'll be somewhat of an, next year when you're doing your taxes, if you're in one of those categories and maybe a couple others, you will find some differences. Business tax cuts also kick in right away. So if you're a business, Yahoo. But as you said, the many of the social safety net cuts are pushed out a little bit. And some of that was to make it look like they weren't being put into effect right away for political benefit, as you say. That's one of the reasons why we see this, and it also makes those cuts look a little bit cheaper, because we talk in terms of 10-year budget windows when we talk about what these cuts are. And if they don't start for a few years, they may look like they're not as much as the ultimate reality. But if they continue into perpetuity, they end up being much more impactful. So even though we have tremendous numbers in terms of cuts here, $1 trillion to Medicaid, hundreds of billions of dollars to the Supplemental Nutritional Assistance Program, or SNAP, those cuts are actually more impactful than even those numbers, because they are delayed and not in effect for the first couple of years.
Hope springs eternal that if Democrats get back into office, they kind of take a page from that playbook, instead of, like with the Medicare drug price negotiations, saying that, we'll do this over, 10 years, 5 drugs at a time, or whatever it was. Just do all of the good things immediately, and then people will start feeling the good effects of your programs.
It's a really good example, because we still don't have those lower drug prices in effect. The Inflation Reduction Act passed in 2022. We will not see the benefit of those lower drug prices until next year. And there was no kind of mechanical reason for doing that. There wasn't a reason that, it takes time to impose these costs or these new prices, like, you change a price tag pretty easily.
Right.
The whole reason was that the pharma industry wanted a few more years of excess profits, and their allies in the Democratic Party were able to get these things delayed. And so, yes, I think the big lesson is for Democrats that as you go forward, you need to give tangible benefits to people within the time frame that you can use it politically.
Right. And so let's talk about these Medicaid and SNAP cuts. Can you give us the top lines and explain how they achieve the cuts?
Sure. So we can start with Medicaid, but there's one that is sort of true across both of these programs, and that is the addition of work requirements. And we have seen these kinds of things in action before in many states. Arkansas briefly had Medicaid work requirements until there was a court case, and they were unable to do it. But for a couple years, they had work requirements in place on Medicaid. And what they found is that most people on Medicaid are actually working. And the goal of these work requirements was not to get more people to work, because at the end of the process with Arkansas, it's not like the workforce had increased to any degree. The goal is to trip people up and get people off the program. So the whole point here is to create a new bureaucracy that people have to comply with on a regular basis, sometimes more than once a year, and make it so that it's hard to not just sign up for Medicaid, but to maintain your coverage and to stay enrolled. And many of the things in the program, when you're talking about cuts, that's what we're talking about. The Congressional Budget Office and other budget analysts look at this and say, okay, this is going to keep people from staying on the plan, or it will stop people from enrolling into the plan. And as a result, we're going to see a lot of people roll off of Medicaid, and that will save money for the government. I mean, that's really what we're talking about here.
So you're taking issue with the CBO estimate here?
Yes, ma'am, I do have an issue with it. The office is very partisan. I mean, 85% of the people in their healthcare division identify as a Democrat, or they've contributed to Democrats, or they're registered Democrats. They're leading, I believe their leading economist is that. We ought to do away with these organizations, because we use them when we like them. We don't use them when we don't like them. And you've got a bunch of bureaucrats in here that are on a lifetime gravy train. And frankly, we've got independent agencies that can do that. We have people up here with accounting degrees that can do the math. So I feel like that is a waste of taxpayers' money.
So in January 2024, there was a Republican who trusted the CBO so much that they reintroduced a resolution to require the House clerk to read the CBO estimate of any bill. I believe that was you, sir, the third time you introduced that resolution. Is that right?
That's correct, ma'am. Of course, and that proves
but
just what I said.
But you don't like the CBO now.
Ma'am?
But you don't like the CBO now. You introduced that resolution over multiple years, but now you're dissing the CBO.
Did the bill pass?
Your resolution?
Did the bill pass? Yes, ma'am.
You introduced it, sir.
I know
it's
it,
irrelevant.
But did it pass? They never pass because nobody wants any verification. It proves my point. When it serves us well,
you took a stance and you were
we're for it, but when it doesn't, we don't. So
you're clear about where you are on the CBO. I just want to say
there are other things, including an introduction of cost sharing in Medicaid. So for one of the first times, several programs, if you go in and try to get a doctor's appointment or some other treatment, you're going to have to pay a higher copay, whereas for most of services in Medicaid, you don't have to pay copays. So that's a new cost that they're just shifting the burden from the government onto the individual. Another big thing is changing something called the provider tax this was a way that states had used to get more resources, federal resources, into their Medicaid programs. What they would do is they would tax providers, healthcare providers, hospitals, clinics, things like that. But then they would increase the reimbursement rate for those providers. So the providers would pay money in, but also get more money back, and they would essentially break even. But the people paying the money back are a combination of the state and the federal government. So the federal government pays some of that share, and the state ends up getting more money to administer Medicaid. That has been frozen and actually curtailed in this program, in this bill. And, I mean, it's a little gimmicky if you just sort of explain what it is. But in the context of this bill, it just means states are going to get less money for their Medicaid programs. And states don't have more money just sitting around to devote to Medicaid. So the result is going to be cutbacks in the Medicaid program, whether in reimbursement or whether in trying to tighten enrollment or something like that. So all of these things combined, and there are many others in the bill, they have the effect of I believe the number is $1 trillion taken out of the health system, out of Medicaid. And this is coming at a time when a lot of hospitals, a lot of clinics, a lot of providers that accept Medicaid are in crisis. There was a report by an organization that said 1/3 of all rural hospitals are at risk of closing. That's right now. That's before this bill, before the bill. And so after this bill, you take $1 trillion out of the health system, you're going to create more crises. You're going to create more rural hospital closures. And as a result, you're going to add overcrowding into other hospitals that remain. You're going to have more people off coverage. The estimate is 12 million people losing their coverage as a result of this bill. And therefore, when those people go into an emergency room, federal law says you have to treat anyone who comes to the emergency room. So that creates more uncompensated care, and that is borne by the hospitals. So you're creating more of a situation where hospitals have to manage their finances in ways that may be incredibly challenging. And you could see a cascading effect where the lowest hanging fruit, the hospitals that are in crisis, they go away, and that business moves to other hospitals, which then themselves get into crisis. It could mean less access. It could mean more overburdened staff. It could mean if you're trying to get an appointment for a doctor, you might not, maybe you waited 20 days. Now you're going to wait 30 days or 40 days or 50 days. So it's, a lot of times this has been described as, well, this is really a bad thing for rural hospitals. And it is. But I think everyone in the health system is going to feel the effects of this.
Hey, 5 seconds. Just wanted to say that this is only possible because of our donors. If you want to see more of this, then consider donating yourself at tvlr.fm/donate.
I want to underline a couple of ththings that you said there that I want to make sure that folks listening don't just gloss over. Because, we're a few of the stations that we're on are conservative talk radio stations. And so there are hosts on some of the stations that we're on that are constantly, I think, frankly, misrepresenting what this bill is doing in a really gross way. And, you mentioned Arkansas's work requirements. Those did not increase the labor force participation rate. I know that you wouldn't know this,
That's right,
David, but a big conversation in Alabama right now is especially around workforce. And that's like part of my job. Like outside of this program, I have a day job and it deals with workforce development. And like everybody, businesses, politicians, educators, everybody is talking about labor force participation rate and how Alabama's is one of the lowest in the country. And Arkansas did not see their labor force participation rate increase when they implemented work requirements, which if we want to think like scientifically, logically, if the hypothesis is there's a bunch of 35-year-olds playing video games in their mother's basement because they have Medicaid, but for some reason, like that's just enough to live on, is you can get health care if you get sick. That didn't push people into the workforce. So we have to try something different. And also, states like California and New York, which obviously have more generous social safety nets, have a higher labor force participation rate than Alabama. So it cannot be that places like Alabama are just too generous, and that's why people are just sitting around at home and not working. There has to be something different that's going on here.
That's right.
Go ahead.
No, I was just going to say that's absolutely right. And when you're talking about work requirements within SNAP or the food stamp program, it's the same thing. And so you got to look at what is the ultimate goal here. And if the ultimate goal does not translate into higher labor force participation rate, then you have to say that the ultimate goal is to kick people off of food stamps and Medicaid. And that's what the demonstrable goal, that's what has happened in states that have, even if briefly, imposed these kind of requirements.
And so then I also want to talk a little bit more about the work requirements, just as something that they're highlighting the work requirements to make the people that will get kicked off of Medicaid seem undeserving. But you mentioned this, and I just want to underscore this. The work requirements are paperwork requirements. And, somebody in the chat said that they heard that these work requirements are basically like filing your taxes every month. And I had this conversation on the radio with one of the conservative hosts. And, I was saying that most of the people that were kicked off from Georgia and Arkansas qualified. If you just look at their situation and you look at their requirements, they qualified, but they were not able to properly jump through all of the hoops that they were mandated to jump through. And so then I was like, they replied with like, oh, well, so what? You're just telling me that somebody could get health care and they just didn't fill out a form correctly and they were just satisfied with that and they didn't get health care. And I'm like, how do you respond to people like that when that's kind of their idea is either people that don't qualify, don't deserve it, and then people that do qualify but can't fill out the paperwork or have difficulties filling out the paperwork also deserve not to get it because they're too stupid or lazy or something, even though they're working and meeting all these requirements. I mean, it's been such a frustrating series of conversations that I've had about this.
Absolutely. I mean, the reality is 61% of Americans on Medicaid work. That's according to the Kaiser Family Foundation. A large percentage of those who don't are either disabled or elderly, because one of the largest segments of people on Medicaid are people who use it to get into nursing homes. Right. These are Medicare, Medicaid dual eligibles, people who are over the age of 65 but have no assets and no income other than Social Security, and so they qualify for Medicaid as well. And we have a stupid system in this country where you have to be super poor in order to get into a nursing home if you can't afford it. So you literally have to draw down all your assets in order to qualify. And then the other fraction of people in Medicaid are children. So you're talking about maybe 3% of the entire Medicaid population that actually doesn't have a job and would have the ability to hold one down. It's a very, very small percentage. And this is not about, it's just not about increasing the workforce. It's about adding red tape to the enrollment system. And we've seen it before. And the way that you know this is that it's only one of many enrollment changes in the program that were put in place in this bill. It's not like everything in this bill is about work requirements. They just took Biden-era rules that improved eligibility, improved enrollment, made it easier to get into Medicaid, and they just obliterated them. And that is, they were designed mostly to, simplify the system. And so, there is an increase in bureaucracy, an increase in the tax on people's free time in this bill. And, the reason that work requirements aren't about work is that everything else in this bill aligns with the way that work requirements worked out, in that it just adds red tape to the system.
Exactly. And when you say make it easier to get into Medicaid, I want to underscore for people, that's not that, Biden was able to usher in some radical liberal communist eligibility,
or
like
a loophole
totally
or something.
Expanded these
Make it
loopholes
easier
or
for
whatever.
people who are eligible for Medicaid to get the coverage that they are entitled to. That's the point. Or that they deserve, or that they're eligible for.
And another, we're a union radio program, so we're really focused on worker protections and stuff like this. And so I have seen, I don't know if you've watched the OSHA heat protection hearings in the House, but it's these conversations are happening as we're talking about increasing paperwork requirements on working people and poor people. And we are trying to make the case, that it is difficult for working people to do paperwork sometimes. Like, and if we don't have to do it, we shouldn't do it. We should make it easy. Like, we should make the government efficient. And at the same time, we're seeing, Republicans just cry about the paperwork requirements that OSHA might put on employers who subject their employees to high heat. And it's just so, the heat protection rule is so loose and generous to employers that it's really, but you've got at the same time, Republicans talking about how hard businesses and multi-billion-dollar corporations have it with these paperwork requirements, as they're imposing even worse paperwork requirements on individual poor people. But I want to set that aside for just a second, and like let's take a let's just change our frame. Let's say that you and I, David, we believe that people who don't work shouldn't get health care. We further believe that people who can't figure out this paperwork also don't deserve health care because they're lazy and dumb or whatever. Okay.
Right.
This is who we are right now. We think that people don't deserve health care.
Yeah.
This is going to hurt me and you, the deserving people who have jobs and health insurance, because it's going to affect our hospitals, right? Explain the effects that this is going to have to people who don't directly lose Medicaid.
Right. I mean, we mentioned this before, that if a bunch of hospitals close, those patients don't go away. They end up going to other hospitals, and they may be a hospital near you. They may have to travel hours to get to that hospital. They may, in an emergency, not be near a hospital in time to deal with that emergency. But in the end, people are going to want to get their health. They're going to need to get health care. And that's going to clog hospitals. It's going to make wait times longer. It's going to wreck the finances of some of those hospitals and create a cascading effect where your hospital might have to close down because of this. It's going to make insurance probably more expensive, because if there's more uncompensated care at hospitals are going to ask more from insurance companies to pay to cover that. So that they can stay in business. And so it may make your premium more. There are all sorts of ways that this is going to wreck the healthcare system, because the healthcare system is very interconnected. You can't just pull $1 trillion out of the healthcare system and have that only be isolated to, 1 or 2 rural hospitals in America. It's going to affect everybody and everybody's care.
Right. And, I've seen people, there's this one video that Ryan Grimm tweeted out of this Republican congressperson literally smoking a cigar and just waving off, all of these millions of people that are going to lose health care.
Can I ask you, though, about the CBO score and the idea that 11 million, 12 million Americans may lose health insurance?
I don't have any faith and confidence in the CBO. They're scoring. They're wrong half the damn time. I don't give any. No,
so
I'm not worried about the CBO.
You're not worried at all that Americans may lose their health care?
Oh, well, just some Americans. that aren't Americans, and that is the illegals. Why should illegals be on Medicare? Shouldn't have it. We did a great job with it all. We did a great job. I appreciate it. The American people spoke. The American people spoke, and the elected representatives spoke today. And what did we do? We supported and passed this one big, beautiful bill. So now you got to accept it and absorb it because it's the right thing to do for the American people.
It's just, I don't know. It's amazing to me that they're just refusing to acknowledge anything that they're doing. And I don't really.
I'll give you another example. I'll give you
go
another
ahead.
example, Jacob, by the way, because you talked about heat protections and worker protections. There's a key worker protection with regard to health care that gets taken out from this bill as well. The Biden administration put in something called the safe staffing rule. And that had to do with a minimum staffing ratio for nursing homes. You would have to have a certain amount of nurses there, a ratio between nurses and residents in those nursing homes. That is going away. And as a result of that going away, nursing homes are going to want to save money, and they're going to have less people caring for your grandmother and your mother in these nursing homes. And so that's another example of how this is going to affect everybody. This is going to, have a dramatic effect on nursing home care in the United States, which was already pretty bad and necessitated the Biden administration to come in and put in the safe staffing rule, which required, I think it was 3 hours of nursing care per resident per day and a registered nurse on site at all times. All of that goes away now.
You just saw a clip from the Valley Labor Report. We are live every Saturday morning from 9:30 a.m. till 12:30 p.m. And we pride ourselves on keeping all of our content free to everybody so that we can talk to as many working folks as possible. If you support the work that we're doing, you think that it's important, you think that it's good, then consider making a monthly contribution to the project, and you can do that on our website, tvlr.fm.